Welcome to this presentation on professionalism. Today we're going to have a look at what it means to be a professional, and particularly what it means to be a professional within the healthcare setting. As an occupational therapy student, you are now a representative of the profession, and as such there's certain aspects of your behaviour that we expect to be in a certain way. We expect you to act professional. So we're going to go through some of the basic concepts really that we feel make up a professional person. So, what is professionalism? Well, the dictionary has quite a broad description really, the combination of all the qualities that are connected with trained and skilled people. Fairly broad, however, I want you just to sort of have a think about what qualities you feel you would expect a professional person to have, and let's just pause the recording for a minute, have a think about it and write a list for me. And hopefully you've managed to compile a small list of what you feel it means to be a professional. Maybe just have a look at this with the person next to you and see if any of your points are the same or any of your points different, and just bear that in mind as we go on through this presentation. I do think it's important to highlight that professionalism and what it means to be a professional is different to different people, and it can change depending on what context you're in. However, that being said, there are some basic principles to consider when we're thinking about professionalism, and that's what we're going to go over in this presentation, and hopefully try to link it clinically to you as an occupational therapy student. So let's just have a little think about some of the main characteristics that underpin professionalism, and let's see if your list matches some of the characteristics that we're going to go over. When I was sort of compiling these lists of traits, I went to the Healthcare Professional Council's website, and they are a professional body that all occupational therapists, once we qualify, we're accountable to really, and they have their own basic set of guidelines and standards and policies and procedures, but there is a section on there around professionalism, and they released a study in 2011 that was completed with a number of different healthcare students and practice placement educators, and they came up with quite an interesting list of characteristics that they felt made someone a professional and reflected someone as a professional or unprofessional, I suppose. The first of these being behaviour. So when we think about behaviour, there's lots of different nuances, but one of the most important things that I feel needs to be reflected in your behaviour is punctuality. Being on time is really important, and I think it reflects badly on you if you aren't. So if this is something that isn't great for you, if you struggle with punctuality, now is the time, before you go out on placement, just to start thinking about some strategies that you can put into place to make you more punctual. So whether that's setting your alarm 5 minutes early, changing your clock so that it's early so that you then arrive on time. It's just really unprofessional if you're turning up to placements or client visits and things like that late. So yeah, punctuality is an important character trait to be aware of. Next, think about your behaviour with colleagues versus your behaviour with service users. And by service users, I mean the patients that you go out to see whilst you're on placement. It's going to be different between colleagues and service users, and perhaps it's dictated by the clinical area that you're working in, but at all points you need to be displaying professional behaviour. For instance, not everyone needs to know about your wild Friday night out. Just keep it appropriate to the context and appropriate to who you're talking to. An interesting sort of thing to be aware of is treating people equally. So, for instance, you might get a placement in a forensic unit, so with people who have committed maybe high level crimes, and you might have certain opinions about that. However, they need to be treated just the same as the sweet little 90-year-old lady that you're treating on your next placement. At the end of the day, they're just people that need your help, and therefore you need to remain professional despite whatever their past history may be. And another important factor to remember is that even outside of the workplace and outside of your placements, you are now reflecting your profession. So you need to just make sure that your behaviour outside of sort of the workplace and placements reflects this, particularly in today's day and age of social media, where every picture is posted online. It isn't unheard of for potential employers to look at employees' Facebook pages to see what they're like, because that's a reflection of you. So whereas I'm not saying, don't not use social media, just be mindful of what you're posting on there, really. So another way to reflect yourself as a professional is within how you communicate. You portray a lot within your verbal communication, obviously, so this needs to be appropriate to the situation, and it will change dependent on the clinical area that you're working in. Be aware of the language that you're using. Your communication and language that you use may be different between your colleagues than it is towards your service users. And sometimes you need to maintain a professional air with your interactions with your service users, and sometimes it's appropriate to be more friendly to engage them in therapy. These are skills that you'll build with practice, but it's important to be aware of and as you start building your own communication style, really. It is also important to be aware of your non-verbal communication skills, as these also demonstrate who you are as a professional. So, be aware of what your facial expression is like, whether you're yawning, fidgeting, just maybe showing that you're not quite interested. You need to make sure you looking people in the eye, look as though you're listening. For example, I had a colleague who had a student that was shadowing them in a clinic, and they actually fell asleep in the clinic room, and they only realised when the service user pointed it out. And I think that student woke up maybe 30 minutes after the assessment had finished. It came to find his educator wondering what had gone on. And I'm sure, as you can imagine, he was quite swiftly removed from that placement, and it's quite an extreme example. But just be, and I suppose it sort of links with your behaviour, really, but just be aware of those non-verbal cues and things like that. It's important to introduce yourself. There is an initiative within the NHS called Hello, My Name Is, which was introduced a few years ago when a doctor who was undergoing cancer treatment found that people just weren't introducing themselves to her, and she didn't know who was coming to see her and what they were doing, and just found it really unprofessional. It doesn't take a lot to say, hi, my name's Jenny and I'm your occupational therapist, and this is what we're going to do today. So yeah, just always introduce yourself to the person that you're working with. Be careful about what personal information you decide to disclose to your service user. Again, it's relative to the clinical area that you're working in, but it's all around maintaining your professional boundaries. Sometimes it's appropriate to share information with clients and sometimes it isn't. And again, it's another skill that you build with time, just be aware of what information you're sharing, really. And lastly, written communication needs to be appropriate to the situation. So for example, no kisses in emails to service users, no personal opinions on written notes. It needs to be very professional. So just to be aware of your communication, really. Now, your appearance says a lot about who you are as a professional. For example, if you turn up to a placement with crumpled clothing, unshowered and unkempt hair and just generally looking a bit scruffy, it doesn't really give off a very good vibe and not a very good sort of first impression, really. And could really hinder establishing that professional relationship. So I personally would always recommend that where possible, your uniform or clothing is clean and ironed, your shoes are appropriate to the place that you are visiting, if you're working on a ward, then long hair should be tied back and jewellery should be appropriate to the clinical setting. It's always recommended to be mindful of any perfume or aftershave that you're wearing and try to keep makeup appropriate to the setting. Ultimately, there are going to be differences dependent on where you work. So, for example, when I worked on a ward, I wore an OT uniform that I tried to keep ironed. I tied my hair back and I wore very minimal jewellery. However, when I worked in private practice, I could pretty much wear what I wanted within reason, including jeans and jumpers and jewellery. But it's just all about remaining professional, and just remember that your outward appearance reflects who you are as a professional. So the next thing to consider is what our professional body's code of ethics actually say about professionalism. Each health professional has their own professional body that they are accountable to, and ours is the Royal College of Occupational Therapists, and in particular the standards relating to professionalism are the Professional Standards for Occupational Therapy and the Code of Ethics and Professional Conduct. I won't go into too much detail about the documents now, but I really would recommend that you go away and read them both. They're not massive documents and they do highlight the basic standards of practice that you should be adhering to as an occupational therapy student. I think the main point I wanted to highlight, as you can see from the quotes that I've taken out of the policies here, is that the documents highlight some of the same attributes of professionalism that we've already spoken about within this presentation. So behaviour, communication, your interaction with colleagues and service users, just to sort of name a few. So yeah, go away and have a read of those because they're quite interesting documents to read. So I just wanted to quickly do some very sort of extreme case studies to show some examples of unprofessional versus professional behaviour. So we've got our first chappie who arrives to work late, his shirt's untucked and he's got messy hair, maybe been out the night before. He goes straight into treatment with the service user, doesn't really introduce himself or provide any explanation as to what he's doing. During that treatment, he's talking to his colleague rather than the service user, talking about how his weekend was. And then when he writes up his notes, he's adding personal and irrelevant opinions, such as that the service user had strong body odour, not really relevant to the treatment that he's done. Whereas here we have our next chappie who arrives on time to work with an appropriate and clean uniform. It's all nice and ironed. He introduces himself to the service user and explains the reason for his visit. He's attentive to the service user, he's friendly and chatty throughout, and when he writes up his note he remains professional and factual. So I'm sure you can all agree who is the unprofessional versus the professional in this situation, but it's just to sort of give you an example of sort of, I suppose, what we're looking at when we're wanting that professional behaviour from you is the chappie on the right. Just the basic things to consider, really. So I suppose we've done a very sort of brief look into professionalism, and as you can see there's actually quite a lot underpinning it, and we really have touched a small part of it today, but hopefully just giving you a bit of an overview as to what it means to be a professional. It may be a good opportunity to think about what we've discussed today and write a list of your own strengths and weaknesses in relation to the areas of professionalism summarised on screen. It really never is too early to start thinking about what sort of professional you want to be and how you can start to show this in your day-to-day interactions. And particularly when you get to the point of your first placement, these are going to be the basic concepts to consider to assist you in being successful. It's what your practice placement educator is going to be looking for, really, particularly around your behaviour and communication skills and your appearance and things like that. I do think it's important to point out that, you know, professionalism and what it means to be a professional is a complex concept with lots of nuances contributing towards what makes someone a professional, and your own professional person will evolve as you progress throughout your training and your careers. So they're just some references to go away and have a look at that I've gone through during the presentation. And remember, professional is not a label you give yourself, it's a description you hope others will apply to you.